Hello and welcome to this episode of Let's Talk About by Kangaroo Minds. I am Vedika and today we have with us Dr. Amanpreet Kaur. Our conversation today is going to center around accessing mental health support. First, I would like to introduce Dr. Amanpreet. Dr. Amanpreet is a clinical psychologist with more than 10 years of clinical experience, and she is at present the assistant professor at the Jindal School of Psychology and Counselling, which is part of the OP Jindal Global University in Sonipat. She has previously worked as a mental health researcher in a global public health organization where she focused on mental health research projects, as well as working in community-based settings. Her focus remains on mindfulness-based trainings, integrated psychological interventions, CBT, palliative care, death and grief anxiety, amongst others. She has also been part of several journal publications, workshops, podcasts, and conversations. Before we begin our conversation today, we would like to put out a trigger warning for our audiences. If at any point during this conversation, should you find yourself feeling triggered or distressed, we urge you to take a step back and look after yourself. Should you need any additional support resources, you can also find them on our website. And now, without taking much time, let's hear more from Dr. Amanpreet. Dr. Amanpreet, welcome to the episode. It's really a pleasure to have you with us today.
Thank you, Vedika. That's great work you're doing. So my pleasure.
Thank you. We're really looking forward to, hearing more from you and your insights because, coming from this space and having worked in so many settings, I think you'll be able to throw more light on, something which we tend to take for granted, that everyone knows how to get support, where to get support, but we both know that that's not always the reality for a lot of people.
So that's true.
So I'm going to start off with asking you something, which is that we know that there are many, many types of mental health professionals and support out there. So can you tell us, a little bit about the distinction between, like a counselor, a clinical psychologist, a counseling psychologist, and we also have therapists, psychiatrists, and also social workers. So if you could just shed a little bit of light on the distinction and, when should who be approached?
I'm glad, Vedika, you asked this question because this is the most often asked question, not just by the clients who are coming to us for the first time, for therapy, but also by the general public, because we belong from a setting where we are not that, psychologically attuned, or, the psychological sophistication is not at as much as it should be. It's amazing, but most public are not aware about the differences between a psychiatrist, a clinical psychologist, or a counselor. So one needs to go through an intensive supervised clinical training before calling himself or herself as a licensed or registered mental health professional or practitioner. For example, to be a doctor, you need to have an MBBS degree. Everybody knows about it. To be a psychiatrist, one would need MBBS and MD in psychiatry, which is post-graduation, specifically. So they go through that intensive training in psychiatry post their MBBS. Now, to be a clinical psychologist, one needs to have an MPhil in clinical psychology. Okay. From an RCI is Rehabilitation Council of India, or, UGC recognized place or an institution. Or they could also have, as per Mental Health Act 2017, they could also have a postgraduate degree, let's say in counseling psychology, clinical psychology, but that needs to have supervisory clinical training as part of it, which is not often there in most of the courses. Those are simply academic courses. So clinical psychologists provide psychotherapy for behavioral and emotional problems, circling, different mental disorders. And they also do psychodiagnostic assessment, which really helps for, diagnosis. And then a counselor is also a trained professional. It's not that a counselor just simply listens. That's not the thing. That person is also a trained professional who helps people in resolving their, emotional conflicts, career-oriented issues. It could be milder problems also, adjustment-related issues, school-related issues, or relationship-related problems. So anyone post their bachelor's or master's can do a PG diploma, okay, in counseling, or a certification in counseling. RCA provides that, and mental health or career counseling. And that's how it is done. And then you also have psychiatric social worker. So, they can do their master's in social work, and then they go on to do their MPhil in psychiatric social work. And usually, in places like NAMHANS, EVHAS, CIP in the institutions or in the Department of Clinical Psychology. You will see Department of Psychiatry, Clinical Psychology, Psychiatric Social Work working together towards one goal. And yes, there are psychiatric nurses also. So, the question comes usually that how do we decide whom to approach at what stage? It depends on a lot of factors. So we are an LMIC, lower middle income country, and we don't have enough trained mental health professionals. I think it's around 0.22 or 0.05 probably as per so much of population. And we can't negate the fact there is, poor availability of mental health services across the country. We can't negate the fact that there's scarcity of mental health centers and, institutions. And also, the availability of psychotropic medications. And mostly poor awareness, about mental health, about mental disorders, and this huge stigma related to mental health, mental disorders, people suffering from mental disorders. So yeah, all these things do affect that.
I'm going to come to the stigma part a little later, but one thing that you mentioned was, around the scarcity of professionals available. And, somewhere in the last 2 years, particularly in the pandemic, Dr. Amanpreet, we've seen a lot of helplines sort of mushrooming, right?
Yeah.
So how does someone know how to, check the authenticity of a helpline?
I think, Vedika, it's you just cannot, check the authenticity of an helpline. During COVID, during the pandemic, a lot of things have changed. See, for example, earlier, nobody used to thought, it's not that online therapy never used to happen. It used to happen, right? And it has been seen to be equally effective. However, with time and during those situations, unprecedented situations, we did shift. There was a major shift for all of us when there was a lockdown. People couldn't travel. From face-to-face therapies to online therapies to even helplines to even audio calls, right? And that has helped so many people, so many people. Not just, the general public, even the health practitioners, the health professionals, they were also seeking help for the same. It definitely countered, the stigma attached to it also, because when you have stigma attached to it, you have reluctance going to or, traveling to a different place because you don't want to be seen by somebody else. Right. You don't want anybody else to know that you're seeking therapy or you're seeking, mental health care. However, with online systems or helplines, you were sitting at your home, right? And even if nobody else is there, you could talk to somebody. So saying how to know the authenticity. So I'm not an IT professional. I don't know about the authenticity of the web page or anything else. However, I know that iCall is there, Sanjeevani is there. So many such organizations had, even they're still working on that. They have the helplines available. I feel, given the fact, the kind of context we are coming from, we don't have trained mental health professionals everywhere or, even at the major cities also. So we cannot just say that only and only we will provide or we'll take care of everybody, because that's not possible. So we need to be open. We need to be open to the fact that, peer support could be there. You could probably train the community health workers. You could probably train the, other professionals, allied professionals, and they could take care of some bit of it, at least not in a very trained way, of course, to teach the techniques. However, they could at least lend a ear, at least listen to somebody else. And that itself could be very, very impactful. And there have been studies about the same, at least in the initial stage where a person can take a step, right? And then post that. But the important thing is they need to be aware, and probably these helplines, if anybody listens to it, can take care of one fact while training their, the professionals who are working with them or the workers who are working with them, to actually refer the people that, this is something I can do. These are my limitations. Post this. I can hear you out. I can be supportive. But after this, if you really want to work on your traumas, really want to work on your grief, really want to work on your personality, these would be the contacts probably you could go to them. Right. So maybe these are the little modifications they could do so that the person who would have reached to them, for the little bit of care, because we cannot comment upon, Vedika, sitting here, that they would not know anything. There might be people who would have helped so many people, tremendously. And so we are simply looking at a bigger picture. Maybe it would be a good idea for them to refer the people to the, relevant people, maybe the psychiatrist for the medication, or for the clinical psychologist, or maybe to somebody else. That's something they could do. Talking about, and they might be authentic, and there might be cases where, because it's an interpersonal situation, it's an interpersonal relationship, 1 hour session. The person may or may not feel comfortable or being, heard or being seen by somebody else who may or may not be trained. Sometimes there are other non-specific factors also involved. So I think that, rather than scrutinizing them, I think it's okay to have helplines, but we cannot just go on and regulate everything. Although as per the acts and as per everything else, regulations, one cannot do this. It should be provided through a trained person. So we can simply assume and expect that they are, the people who are providing services on audio calls or probably on video calls, they should be trained counselors or clinical psychologists or probably a psychiatrist. Beyond that, it's something which is out of our, regulatory control.
Right. Something you touched upon earlier also is that, there are a lot of barriers that people face when it comes to, reaching out for support and accessing support. So from your experience, can you tell us, what are some of these barriers?
I think first and foremost, it's stigma, which we've been mentioning again and again. That one type of stigma is how others will see me if they get to know that I'm mentally ill. And the second is, what do I think of myself as a person suffering from mental disorder? Because the same person is part of the same society. The belief system is developed as part of the same society. So because I come from that same society I live in, I would be affected by that. What if someone sees me, taking treatment over there? And people do report that. What if someone judges me, for being who I am? The what if questions. This further affects one's help-seeking abilities. You were asking, what really affects? What are the barriers? So this is one of the major barriers. Second thing is the awareness. When we're talking about where to go to, how to go to, so in schools, let's say, this huge stigma around it, and nobody really wants to talk about it, as if it's something, supernatural or not normal. And nobody's prepared for that. People think that you need to have, some kind of mysteriousness is surrounded around, mental disorders. And that's the reason. So it all impacts help-seeking behaviors. It takes huge amount of effort, courage, and, time to proceed for therapy, to proceed for, even trying to take psychotropic medications, finding out who to seek therapy from and how, whether or not to take medication. So then comes a huge problem of logistics, Vedika, and resources, especially when you belong from remote areas, right, and rural areas. And we need to be mindful of the fact that, there are very few metropolitan cities all across India. And major sections do not have a great access to psychiatric hospitals, trained mental health practitioners or professionals, right, or even having the awareness about the same. So we can't really say that, as a that one shouldn't be going to a traditional or spiritual healer, or probably someone who calls himself or herself as a psychologist or a counselor or a life coach probably, but has ever been into, they've not been into supervised clinical training. Now, the general public would not get to know about it because we know that who's a doctor, who provides medication. So everybody knows about it. Beyond that, the further, nuances and nitty-gritties, people are not aware about it. And unlike other countries in India, referrals are made from the psychiatrist, here. So who would give psychotropic medications and make diagnosis, while a clinical psychologist would take care of the psychotherapy. So usually psychotherapy and psychotropic medications work very well when administered together. That's what the researchers say.
Right.
Yeah.
No, I think, that makes a lot of sense that, even the fear of judgment combined with not knowing enough, right? Like, where do we get to? And faith healers and things is something I'm going to come to later. But, talking about stigma, and we spoke a lot about, there's two things: how are others going to judge me, but also how am I going to look at myself? Because knowing that, unfortunately, we still look at mental illness as a sign of weakness, or, this is this is my personality, it's not, it's like a flaw, which we tend to see it as. How do you think we can counter that stigma?
Yeah, so for countering stigma, there are many approaches. There are so many approaches theoretically. One is an educational approach. One is, another one is using the success stories of people, who would have, suffered from mental disorder, and then, going forward to share it with the other, the general public, that this is what happened with me and this is what I did, right? And, the third thing, very, very important, is to use the information material, not just for the education purposes, but also there are theater used, audio and visual aids which are used. So there are so many different approaches which one can use to counter it and to increase the awareness and, raise the health-seeking behaviors. And I would say, as I mentioned about the religious healers or the spiritual healers or the traditional healers, I think it would be important to include them as part of the whole approach, right? And because they come from that society and they have good relationship with the local communities, they have the trust. And to gain that trust, to actually increase the awareness, it's not important to simply say that, just get out of this whole thing, we will take care of it. Rather, they could be made part of the whole campaign, the whole system, and we could work together as, to eradicate stigma further. Because stigma doesn't really, it's not just related to poor awareness, it's also related with the funding and infrastructure which comes from the health system. So both the things are there.
And I think also the other thing about stigma is also that, sometimes within the health system itself, there's a lot of stigma, especially around certain conditions. Like we've heard a lot that, how individuals with borderline personality disorder, or if you want to call it emotionally unstable personality disorder or psychosis, like, the heavy stigma that label itself carries, not just for the individual, but also within, the medical system itself. So I think that's also something, which needs to be worked on. And probably if you look at these integrated approaches, we could look at having, solutions to those kind of issues as well.
Yeah.
But coming to, again, like, the whole aspect of faith healers, spirituality, this belief that there's something supernatural involved in having mental health issues, we see that a lot in, rural communities or communities with low awareness. And I'm sure you've seen that as well, in your work while you worked within community-based settings. So, how do you think, we can reach out to these populations?
Yeah. So Vedika, I think there are enough number of, researches which have been done in the rural areas also. So we can't say that in the urban areas, the stigma is not there. It is still there. It's just about, I think, the availability of the mental health services, which is better in urban areas than to the rural areas. So I think that's one of the factors. And, we've talked about spirituality already, how we can make use of that. So what is your question exactly, Vedika?
So what I was trying to ask you is that, how do we reach out to these populations where, they are cut off from, like urban areas, or they're in areas with very low awareness? How do you reach out to them,
So to reach out to them, you have primary healthcare centers. So each village will have, or 2 or 3 villages will have one primary healthcare center. Usually one medical, officer is present over there who's done an MBBS, who's a physician, and there might be a nurse, there might be a dentist available and the pharmacist available. The only thing is, at few of the centers, because after primary healthcare centers, you have the secondary system. You can have a district hospital also as per the each district. So each district hospital will at least have one psychiatrist. It has happened after the so many changes have happened in the district mental health program as part of DMHP and NMHP. And then, there could be counselors also, psychologists also available over there. Now, when you talk about the whole district, it has a lot of population. And then there's one hospital which is taking care of it. You do have private hospitals available, which may have, nowadays they've started having Department of Psychiatry also, Department of Clinical Psychology also, all across. But the important thing is, what is available, Vedika, when you talk about the rural areas? There might be a local clinic, there
Right.
might be an RMP, who's a registered medical practitioner but may not have done MBBS. There might be the Babas sitting over there. And there's nothing wrong in that, but it's just that. And there might be traditional healers also, right? So the person feels the discomfort, the distress, and this person knows these are the people available, and he just or she goes over there for help. Now, those people need to also be trained and aware about, okay, these are the signs, these are the symptoms. Now we need to refer this person to this place. So till the time so many years pass, or till the time the person becomes aware through somebody else, so many years get passed, or the problem becomes chronic. So it is important to include not just make the public aware about these things and how to reach out to them through these places. Right, through community health workers who are known as ASHA workers, who have good relationship, right? To reach out to the role models, or maybe let's say the sarpanch or the nambardars who are there in each of the communities or each of these villages, who have a great role in terms of impacting the public, and reach out to them. And then making use of audiovisual aids also. And there have been researches done where they've made use of local theaters, the drama being done over there, videos being shown over there, where people who really suffered, who shared their lived experience in terms of this is what happened with me. I took the treatment and I got well. So it's not something which is addictive. It's not something, which you need to self-medicate, or it's not something you'll just go to a temple and you'll be fine. You need, just like a physical illness, you have thyroid, you have blood pressure problem, you take a pill for that. Similarly, you have therapy and, pills available here also. So yeah, that is possible, definitely.
So, you mentioned very interestingly the aspect of lived experience. And one of the things that we do is we do have a series called, Stories of Hope, where we get people to share their stories. But somewhere I think we need to realize that, there's only that much that lived experience does, right? Because it's not a substitute to professional expertise, unless someone is trained, of course. So, where do you sort of draw that line between, lived experience and professional help?
There are no limitations as such, Vedika. I know so many people who have had the lived experience, who have shared their successful stories, and they went on to become the mental health advocates. Not all do that, but that is something I've seen. There are many people who are actively doing the work. And I'm not sure whether I'm understanding your question correctly or not, but when we talk about the lived experiences, Vedika, it is very important. Let's say I am telling the public, that if you do this, this will be good for you, and this is okay to do it. It is okay to be sick. It is okay to seek therapy or take medication. Versus a person comes and says, who's from that community, talks their language, in their language itself, whether it's Kannada, whether it's, Telugu, whether it's, Haryanvi, and the person talks to them in their context and says that, look, I went through all these things. This is what was happening with me. My family went through this. I did this, didn't work out. And then I got to know about the psychiatrist, the psychologist. I took help. I took therapy. I took medication as per, directed. And now I'm doing pretty well. I'm back at my job. I'm back with my, family members, and things are going great. And I would urge everybody, to whoever is facing the similar issues, please go out and take help. So there's huge difference between somebody who may not have had the lived experience, but comes with an expertise, talks about it. You're listening to that person with a sense of respect. Versus you're listening to that person with a sense of respect, empathy, and a familiarity. So that would hold more weightage, definitely. So it is important to include people with lived experiences, of mental illness, to be included as part of, raising the awareness and educating the people about the same.
Right.
But at the same time, we cannot compel or, ask everybody who's taking help to come out and talk about it, because you cannot negate the fact that we live in a society where there's huge stigma around it. It could affect their employment. It could affect their so many other things. And we have to respect the confidentiality in that purpose.
Completely understand, the whole thing around, holding space for people with lived experiences, which is part of the reason, even why we tend to curate, stories of hope, because it gives you that familiarity, it gives you a sense of representation as well, that I can connect with this person. But I think that was the whole thing. And I think you touched upon it that, there's a difference between lived experience and professional experience. And sometimes just knowing that goes a long way. But we spoke about mental health professionals, we spoke about the various kinds of professionals. But when it comes to actually selecting a professional, like what are some things that people should keep in mind while doing that?
Yeah, I think first important thing is to at least be prepared. And, as I stated earlier, it takes huge amount of courage to even start doing that. I think one needs to look at many practical things also, such as the fees taken per session. It's not a pro bono work. They are the professional, you're taking the services from them. So they would charge you. It could vary from person to person. It's a 45-minute to 1 hour session. And it's not just one session. There are many sessions, whether with the psychiatrist or with the clinical psychologist or with the psychiatric social worker. It could be lesser time also, depending upon various factors, right? But usually the proper session, it ranges from 45 minutes to 1 hour. And a therapist will not give you or prescribe medications, while a psychiatrist will prescribe medications. And if the symptomatology or intensity, frequency say so, it could vary again. So the number of sessions for therapy could range from 15 to even more than 80, depending upon, again, type of problems, many other factors, the therapy goals. Secondly, you need to see if you could find someone in your city or town, in probably the proximity. If it's easily accessible, then face-to-face therapy. If not, then online therapy. And there are so many, advantages of online therapy, because especially talking about the young adults or even the, let's say with children and with the elderly who may not be tech savvy, and with people who might be, symptomatic. It could be difficult for them to have online therapy. But for others, it works very well and it's equally effective. And you could actually be sitting in Mumbai and, talking to your professional whom you cannot visit in person. And that person might be sitting in Delhi, just like we are doing right now.
Right.
And, after COVID came into our lives, we also became flexible and then, efficient with respect to online therapy services, the way it is being provided, and then the comfort and trust level between the person and between the therapist or the psychiatrist. It's not like a relationship you have with your friend or family member or a teacher or a spiritual guru. Rather, it's a professional working relationship which has its own boundaries, set way of functioning. So really it comes down to many, as I mentioned earlier, the non-specific factors. Do you feel heard? Do you feel the trust over there in the relationship? Do you feel understood, etc., which is different from specific factors such as what kind of therapy is being used, what kind of techniques will be used, and how it's been applied, etc. That's important. So a lot of things come into play. Practitioners nowadays, write in their profiles also what are their expertise in and what are their research or clinical interests. You have organizations like Therapy, Neve, Hackman Institute, Healing Space, etc., which provide online therapies by trained mental health experts, while there are many more working offline, or face-to-face, whether psychiatrists in different private or government, institutions or hospitals, or clinical psychologists or counselors. And you have famous psychiatric institutions such as, NIMHANS Bangalore, IBHAS in Delhi, RENPAS, CIP, Ranchi, Tejpur, Gujarat, Secunderabad, so many. And I've already talked about, how to recognize with the degree who's who. But having said that, even if the person is trained, even if you have the awareness, sometimes the match may or may not happen. We always suggest that you need to see at least for 5 to 6 sessions, at least, right? Because the first 2-3 session may go into detailed history taking only. And sometimes people who are not oriented to this thing, they might feel that, oh, the person is simply asking questions, nothing happened. Yeah, because they are not mind readers. So to recognize the whole thing for the construction of the hypothesis and everything, they need to take the full history taking. Yeah.
No, I think, also when you were talking about the non-specific aspects, you spoke about, building rapport and things and, building trust, feeling seen and heard. But individuals also tend to have concerns around, issues like confidentiality, consent, ethics, safeguarding. And I'm sure you've been asked a lot about this also. So can you just throw a little bit of light on, these various aspects and, what they would look like in a mental health professional sort of setting?
So, Vedika, each person has his or her own way of practicing. However, the standard way of following it, or the ethically, how do we go about it? It's to share an informed consent form. Just like we do it before asking somebody else to fill up a questionnaire, that your details would be protected. It would be anonymous. You would see the people in psychiatry, psychology to be working at the backhand rather than coming in front and, talking openly about it, because there are aspects of confidentiality, trust, and, ethics involved in it for the clinical practice. So once this is read and signed by the client, an appointment is scheduled, which is usually once a week, but could vary, based upon, again, type and intensity of symptoms. So this informed consent form talks about working hours, how to contact and medium of contacting, what is the session fee, how to pay, confidentiality issues, when to contact, when not to. What is psychotherapy? Because keeping in mind that people may not be aware about it, this might be their first time. Even if it's not their first time, still you need to, inform them about the thing. How many sessions are to be expected or not? What are the risks involved? What are the benefits involved? There's a no self-harm clause also added into it, right? And where to go to seek help during emergency situations, or local psychiatric facilities available around that person's, area. And, the legal aspects. So if the court subpoenas you, then you'll have to answer back. Otherwise, you're not answerable to anybody. So you would be informing the person before talking about it, right? And the research related aspects, that their details, their personal details would always be protected. It's not that you're seeing a client and then you're just going out and saying, oh, this is what happened with my client and all, till the time it is discussed in a very safe, supervisory setting where you're supposed to discuss that. So the client makes an informed choice and then gives a consent for the same, right? And then you start the therapy, and keeping in mind the training, issues related to awareness, ethical standards, etc. Professionals may or may not share an informed consent form with the client before starting to do therapy. It could be vague for the client in those situations, since we don't have much awareness in the public about mental health or therapy. So on a lighter note, just compare the way therapy is portrayed in Hollywood versus in Bollywood. There's a huge difference. You have in Bollywood, movies like Dear Zindagi, where therapy just ends abruptly and they're walking on the beaches. No, this is not how therapy works. And anyhow, in our society, doctor is supposed to be a person who gives you medications. People like to self-medicate themselves. So no, psychotropic medicines are not paracetamol, that you do it as per your wish. These are not addictive. That's a myth. And one needs to follow up with your, the psychiatrist for the medications. And also, people don't ask their treating doctor any questions. Ask what medicines you've been given. Ask what, why, how often, for how long. Similarly, same questions you could ask for therapy. I remember one of my clients, showed the, medicines to me, and half of them were multivitamins. And there was one for the mood. And, I could just tell the person that, next time do ask, what is your diagnosis? What kind of medication have been given for what? And you just need to be aware about it and just follow what your doctor says. And you are not supposed to taper it down. The doctor will taper it down.
Yeah. I think, you just spoke about like tapering down medication, but something we also see in therapy is, unfortunately, a lot of times people tend to drop out of therapy. So, why do you think that tends to happen?
See, as I mentioned earlier, there are multiple factors. It could be, I'm just speculating right now, right? So dissatisfaction with the outcome, probably, or the process, or the vagueness around it. So if you're not prepared, maybe you are not informed from the professional side that, how many sessions are to be expected, how often we would be meeting, and how exactly we are going to move forward. There are chances that the person suddenly might drop out, and it may not always be related to the process of the therapy. It might be related to the client side also. Sometimes it could be related to the finances. Sometimes it could be related to many other factors. Many times people aren't told or informed that it takes time with mental disorders. One needs to be patient to see the changes in behavior, the thoughts and emotion. You have not built it up overnight. It's not the fever which just developed overnight and you just take one medicine and it's gone. So it can take 2 to 3 months time, actually, realistically speaking. While most are attuned to believe that within 1 or 2 sessions, some magic will happen, it doesn't happen. And 1 or 2 days, medications, they should get well. While reality is way different from, what they believe in. So when the expectations don't match up with the reality, and while reality is, so different, and one tends to become dissatisfied and may drop out. This is one of the reasons. Another thing, as I said, could be financial reasons. We don't have insurance system here in India. Third people, the third thing could be people start getting, better. And as soon as they feel that they are doing great, now things are becoming better, they will go off the medication and stop coming for therapy while it needs, or probably say, I don't need it now. Maybe I'll just think of it in the emergency situation. Something happens all of a sudden, then they come running. So it needs to be tapered down gradually by the expert, and sessions need to be terminated as per the therapy goals and treatment plan. So it's not even their fault, because when we talk about the knowledge aspect and everything, so what needs to be understood, and the fact that, with in psychiatry, it takes time, right? And how it's done. So, and no, mental health professionals just don't listen all the time. There are active work also which has been done, but however, first few sessions, as I stated earlier, could be detailed history taking, which may give a wrong impression sometimes to the clients who are not accustomed to this and expect some on the spot, as if it's a Sanjeevni booty, which will be given to them and they'll be perfectly fine.
Right.
That's not how it goes. So if you don't feel comfortable with one mental health practitioner, then be transparent about it, discuss it, out with the person, and, explore the issues and explore other. So maybe you could be referred to someone else better suited to you and your needs. That is definitely possible.
Just another thing in terms of, we've had lots of conversation already around, professionals and what to expect. But one of the fundamentals is, how should someone know that, they need to seek help? Like, what are some signs to look out for?
Yeah. I think one very important thing to be kept in mind is that you don't need a diagnosis to seek professional help for your mental health. You don't. I've seen and helped many people who wanted to work on themselves, and they did not wait for any full-blown, illness or diagnosis to be made. We are all humans. We all have certain limitations, and we all are not skilled emotionally, or we have, the bestest of the best coping resources psychologically in all situations. So that's fine. Coming back to your question, the early signs are when exactly. So there's no set timeline. However, if one is facing symptoms of anxiety, depression, or repetitive thoughts, etc., experiencing significant distress in personal occupational life for 2 or more than 2 weeks, that could be the standard taken. Then that could be an early sign. If it doesn't go away, stays with you in your mind, bothers you again and again, whatever it may be, please reach out for help. I would say that. It may start off with sleep disturbances, appetite disturbances, and then moving forward to your mood in general, how you're reacting to others, responding to others, that also. So probably 2 or more than 2 weeks, if it's happening, please seek help.
And, another aspect is that, people feel that this is taking really long, which is why often they either start self-medicating or tapering off medication, or they may drop out. But, it's not like a broken bone where you can see, in an X-ray or whatever that you're healing or it's getting better. But what are some signs that people can look out for that, that they are in recovery? Because, that can help them be aware of sort of the progress that they're making.
I think there are, you can't say that, we don't have any tools to know. It's not just qualitative. So the rating scales we have in therapy, which is known as, part of behavioral assessment. So people do use that, from time and again, first session, and then in between after few session, and then towards the end. So that shows us, that quantifies that, these were the ratings initially, and now this is the rating now. So qualitatively also the person is able to share and report. However, but quantitatively also you could do that. So that's one way of going about it, which is done very well. Another thing is, I think the person also gets to know. So when your frequency, intensity, and duration comes down of your symptoms, that's when you know that, you're healing. And one very, very important thing, therapy is not something to make you feel good about yourself or something goody feeling. No, sometimes it could, leave you very overwhelmed. You need to do the homework assignments also as part of it. Not as part of the teacher-student relationship, it's a professional relationship, but that is something. So you have a person who's an expert who facilitates the whole, the conversation, the whole process. But then, yes, the client also needs to work towards it. And approaching your difficult emotions, it's not easy.
Hmm.
So that's where the assistants come into play.
So, Amanpreet, to wrap up, I'm going to ask you one last question, and that's going to be that, if you had any parting words, someone who's watching this who might be having a hard time with their mental health right now, what would that be?
I would just say that, please reach out for help. Let's say you do not have anybody who's professionally sound. You have somebody, you could trust, a friend or a family member you could confide in. Reach out or contact your friend or acquaintance who may belong from maybe this field, right? Many times this happens. People reach out for referrals. So they may not see you for therapy for ethical reasons because they know you personally, but they could refer you to someone experienced or somebody trained or who's available or practicing around you. If not, you have online services available. As I mentioned, so many different places who are, giving their services online, and there are trained experts working with them. And you have Department of Psychiatry, Department of Clinical Psychology, or Psychiatric Social Work, whichever hospital is nearby around you, whether government or private. There is no harm, no shame, and no risk involved in seeking help for your mental health. It's equally important, just like physical health. So another important thing to be kept in mind is that one could ensure that, they're physically active on a daily basis, right? They can try to be engaged. People just say, very loosely that, oh, try to be busy, try to distract yourself. No, that doesn't help. Try to engage in meaningful and pleasurable activities, which could also give you a sense of worth, sense of mastery. Engaging in self-care activities, and importantly, stay connected with others. And when somebody is suffering emotionally, it becomes so difficult. Whatever I've just said, it becomes difficult to do so. And that's the reason you need people to help you out. So please reach out for help. Anybody and anyone can suffer from mental illness, and that is okay.
No, thank you so much for that. And thank you for taking our time to be with us today and share all your insights. Really, really appreciate it. And, lastly, for anyone who's watching this right now, if you're having a hard time with your mental health, please know that it does get better and there is help out there. So, you're not alone in what you're going through, and you don't need to struggle in silence. So till next time, please stay well and stay healthy. Thank you.